What is up, Healthcare Squad? Logan here with Healthcare Stress Relief, and in this video I'm going to be covering why nurses are leaving the profession at an alarming rate. As you know, the burnout rates in healthcare are increasing significantly, especially related to the COVID pandemic. If you clicked on this video, there's a high likelihood that you are burning out or already burned out. So stick around to the end. I'm going to give tips on what you can do about this. I know for many of you, you jumped into this career because you wanted to make an impact on humanity. You wanted to help those who were sick and give quality care for the vulnerable in our population. And unfortunately, when you first started nursing, you were probably much happier than how you are now, as the system has slowly stripped away some of your own humanity. If we look at the research in stress in healthcare, 1 in 5 healthcare workers are reporting either anxiety, PTSD, or depression, which is very high, 20%. And when you look at doctors in this profession, 6 out of 10 of them in a study of 12,000 doctors said that they would not continue the profession if they were financially able to do so. 6 out of 10, that is 60%. Not only is this costing the hospitals millions of dollars, it's also causing you to be another cog in the system who just gets chewed up and spit out. And on top of that, our patients aren't getting quality care. I could only imagine if one of my beloved family members ends up in the hospital and one of the nurses was completely burned out. What kind of care is that person going to receive? It's not going to be very good. And unfortunately, we're going to have to start bringing more awareness to this issue because it's not being talked about enough. That's why I started this business and this YouTube channel. And we are going to have to start fighting back and demanding more from our system. So in the first section of this video, I'm just going to underline the problems. Number 1, healthcare is a business. As I've said in other videos, the system is not broken. It's working exactly how it was designed, for profit. And in our system, everything is about making money. As a nurse, you don't even know how much your patients are getting charged. So if a respiratory therapist walks by and sees that you still have oxygen on the patient, they're going to charge that patient. If we knew all of the numbers, I believe that our care would change significantly because we would care more about the patient's overall well-being. How are they going to be financially after they get out of the hospital? Number 2, you are constantly in a state of fight or flight. There's no doubt that healthcare is extremely stressful, especially if you're working in ER, intensive care, oncology. You can only sustain a high level of cortisol and adrenaline for such a period of time until you start to manifest symptoms. So many of you watching this are probably living with very high cortisol levels. And I don't need to explain to you the damage that this can cause. You already have a medical degree, but it can get pretty ugly. Number 3, you're being called a healthcare hero, and all that management is giving in return is an ice cream party with some pizza and a pat on the back. This can be very frustrating if you are a frontline worker because you want real change. You want safer patient ratios. You want more staff so you can be a little bit less stressed and you can provide better care. And your patients can get better care, the care they deserve. And so this is placing a huge burden on our healthcare workers because everyone's calling healthcare workers heroes, but we're not getting any change in the system. I don't want to be called a hero. I want change to happen. When Superman saves the city, he gets the key to the city. When nurses save patients, they get a pizza party. And come on. Number 4, a lot of people are reporting this right now. Your coworkers, management, fill in the blank, they are complete jerks. And this is the toxic environment scenario that happens in a lot of places. And it can make your career absolutely miserable. But there are ways to deal with this, and I'm going to cover that right now. I don't want to be all doom and gloom. I know that the things that I just mentioned are just the tip of the iceberg. There are a lot of problems within healthcare. With that being said, you chose healthcare because it is a very rewarding profession. and I'm going to give you some solutions to these problems so that we can perform our best and still enjoy our lives. The first thing you can do is accept your circumstances. Yes, I basically say that healthcare is a business and that basically they don't care about you. You are just another cog in the wheel. With that being said, you can do one of two things. You can just completely quit and be done with it, or you can accept it. And once you accept it, then you can take the steps that are in your control to still enjoy yourself, but you can't do that until you accept it. If you're going to be the person that doesn't accept it and complains and does nothing about it and doesn't change their own habits, then you have no right to complain. Number two, you can invest in yourself. For me, I invested in some mentorship when I was a nurse. Completely changed my life. Was it difficult for me to make that initial $1,000, $2,000 payment? Yes, absolutely. But oftentimes when you put money down, you are actually guaranteeing your success, because if you have skin in the game, you're more likely to get the results you want. So invest in yourself. I have mentorship available to all of you healthcare workers. I currently have one-on-one coaching and group coaching. So if you're interested in that, click the link below. Number three, learn and implement better self-care strategies. I have a video right here that is all about self-care. Go ahead and check that out. Your self-care is extremely important. I know that the majority of burnout can come from the workplace, like 90% of it, but that 10% of taking care of yourself, it is extremely important. If you're not doing that, you are going to burn out. Number five, stop being a martyr. Learn to say no and stop accepting yourself as the person that has to save everyone. When you get off of your shift, you got to let it go. I know sometimes it's hard, but you cannot worry about every little thing. If you are consistently worrying about all of your patients and their outcomes and what can happen, it's a recipe for disaster, because in this life, we can't control anything. We can control our own body and what we do and how we react, but we can't control the outcomes of other people. There will be patients who will die on your watch, and it's not your fault. As long as you show up and give your best, then you should be able to go home and sleep like a baby. Number six, learning assertiveness. When I was a new grad, I was not assertive at all. I let people boss me around. I let people bully me, all in the name of basically just not stirring the pot and not getting fired and not letting people not like me because I was being assertive. Being assertive is the most important thing for healthcare. You're going to have doctors consistently get mad at you and yell at you over the phone and tell you not to call them again, and then when you don't call them, they're going to get mad at you because you didn't call them. Ways to fix this is learning assertiveness, learning to be more confident, and basically telling people how you feel and what you expect. My friend Dave Soltau and I were going to be putting together an assertiveness training with 3 other hotshot nurses. All of these people have a lot of experience in the profession, from management to being an Army nurse, and 20 plus years of experience. Altogether, these people have probably 60 years of experience. So it's going to be an amazing program. Keep your eyes out for that. So with all this being said, the lessons here are basically acceptance and self-care. Invest in yourself, learn more about yourself, accept what you can't control what you can, and you will do much better in your profession and in this system. With that being said, if you enjoyed this video, go ahead and hit that subscribe button. Go ahead and comment if you have any questions or you want to argue with me in the comment section. I'm all for it. And if you enjoyed this video, go ahead and check out these 2 right here. With that being said, thank you so much for watching. Stay strong, Healthcare Squad. Talk to you later.